Freedom HealthWorks is the direct primary care accelerator. We help doctors across the country start fresh in direct primary care. With Freedom HealthWorks, you work with a team, not a checklist. Visit freedomhealthworks.com and together we can achieve true freedom in direct care.
Hi, everybody. Welcome to Healthcare Americana. I am your host, Christopher Habig, CEO and co-founder of Freedom HealthWorks. A theme that we find ourselves repeating time and time again as we get fired up and get into these discussions with all of our great guests is the fact that we all seem to lose this ability for us to spend money wisely. The American consumer is an economic force by every definition of that term. And we pride ourselves on being able to go out, compare products, compare services, see what other people say, whether it's restaurants, whether it's automobiles, whether it is anything under the sun, even the largest online marketplace on Amazon, we're looking at and trusting consumer reviews. However, whenever a case arises that we have to look after our health and ask the right type of questions, or really the same type of questions about doctors, hospitals, and even insurance plans, most of us are intimidated, fearful, or we just flat out forget it. And I understand that because it is a very stressful time. So joining us today on this podcast is Matthew Dale, the Chief Executive Officer of Point Health. And Point Health and Matt are working to provide that knowledge, provide that transparency, and provide that ability for the American consumer to go out, find physicians, and have all the information they need about them from an economic stance, and finding out that they are good quality physicians at the same time. So they're doing some really amazing stuff. Matt, welcome to the program. Welcome to Healthcare Americana.
Great. Thank you very much for having me on.
Give us a quick overview of how Point Health and the projects you're working on satisfies that need for the American consumer to be educated and remain educated when it comes to healthcare decisions.
Yeah, absolutely. So, I mean, you touched on obviously one of the core issues, and that is that it's really difficult to shop for healthcare. If I were to ask for, somebody, where do you go to buy household goods? They're going to say, oh, I can go to Amazon, or I could go to Walmart. If I said, where are you going to go to get food delivered? They could say, get on Grubhub or Uber Eats, movie tickets, you're going to go to Fandango. But if you ask somebody the question, where do you go to shop for healthcare? People have a really hard time answering that question. And it's incredibly surprising when you realize that, healthcare is probably the largest segment of the American economy, 3 trillion plus a year. And part of the reason that you can't shop for healthcare is there's 3 pieces of information you need in order to make an informed decision, none of which are actually that easily available. I think in order to make an informed purchasing decision, you have, and while the cost might be, out there in some way for a highly sort of informed healthcare insider to understand, it's not available in a way that a consumer can readily understand it. The second piece of information you need is actually even harder to get to than the cost, and that's really understanding the outcome data. It's understanding, which hospitals are better than others, which surgeons are better than others, where am I likely to go in and have a positive outcome. And then the third piece of information, this one you can find, but it's really found in isolation, and that's what's my experience going to be like. That's really there. You're talking about, how long did the doctor spend talking to me? How friendly was the receptionist? All of those types of things. But until someone's able to pull together all 3 of those data points and present them in a way where it's easy to search for a procedure and then see which facilities can offer it at what cost, with what level of quality, and what your user experience is going to be, you're not going to see anyone really capture sort of a large percentage of the market share when it comes to helping healthcare consumers figure out where to shop for healthcare.
Those are 3 excellent points. And I want to dive into each one separately. So when you do ask the question of how do you shop for healthcare, how do you find out what the price is? In our experience at Freedom, and then in personal experience, it's whatever that little card in my wallet pays for. Or if there's no little insurance card in my wallet, well, I don't know what it's going to cost because I don't even want to think about going to see the doctor because I'm terrified I'm going to go bankrupt, you name it. What is your response to people in those scenarios when they say, I don't even think to ask those questions about pricing?
Yeah, so I mean, I think, well, there's certainly truth to what you said. The fact that, you have an insurance card doesn't actually tell you what you're going to pay. I mean, for us, we've dealt with people's medical claims for 25 years now. And I can tell you, people are always shocked by what they actually end up paying for care, no matter what type of plan they're on. There's always some sort of surprise billing that happens, or they went out of network. And so even having insurance, it doesn't actually provide the safety net that people think. When it comes to trying to find out the price, it's not as easy as asking because you're not making apples to apples comparisons. And so I can give a couple of examples of this. But it really, and it boils down to like what I would call like data integrity. And so inside of the world of healthcare data, you have 2% of providers that are actually part of the transparency movement and are providing clear, easy to understand information. And so, these are the places everyone in the, follows price transparency is familiar with, right? It's Surgery Center of Oklahoma, it's Texas Free Market Surgery. There's places out there that are putting bundled prices, say, hey, if you come in and have this procedure done, this is what it's going to cost sort of all in. But you move away from that 1 or 2% of prices. I describe that section of it as like, it's like swimming in crystal clear water. But you get outside of that 2%, the water gets really murky really fast. And so you might call a hospital. I'll give a real example here of a case. But we had a guy that came through our system that needed a rotator cuff repair. If he had gone to his local hospital, he would have been charged $65,000 for it, and his insurance would have paid $3,000. The insurance plan he was on told him to go to his local hospital. And we were able to figure out, no, actually, you want to go to a surgery center that's 30 minutes away. You can get the whole thing done for $7,000. You're only going to pay $4,000 out of pocket. But even if you go in and you don't have insurance, you're not making an apples to apples comparison because hospitals, for the most part, aren't bundling their prices. So, if you see the cost of a colonoscopy at Texas Free Market Surgery being $2,500, and then you see the cost of a colonoscopy being $2,300 at Sedon, which is the local hospital here in Austin, you're actually making a mistake if you go to Sedon because Sedon is only quoting you the facility fee, and the surgeon or the gastroenterologist and the anesthesiologist are both going to bill separately. Whereas if you go to Texas Free Market Surgery, it's that all in one price. So it's just impossible to make that apples to apples comparison for the average consumer. And it's a real challenge.
Do you find that people that are asking, you mentioned the average consumer, and to me, those are people who have never used the healthcare industry, have never needed to, they're healthy, they have never had a baby, something like that. Are you seeing that those are the people who time and time again get absolutely burnt? They learn a lot. So then the second time around, they have a better idea of what questions to ask, or they're more apt to ask those questions? Or do they just still sit there and saying, I don't even want to mess with this, even though I got smoked last time, I'm going to go back into this and just jump in the deep end without a life preserver on?
Well, I think we see a little bit of both. I think some people go in, have an experience with, having a surgery done inside of a hospital, and they learn, hey, I've got to ask what else is, where else is going to send me a bill? What are the other providers that are going to be involved in this episode of care? But I think, there's a lot of people that, even though they know it's happened to them once, it's still so confusing, especially if they actually have insurance, because just trying to sort through, the explanation of benefits they might get from their insurance company, and not necessarily understanding why, even though the hospital was in network, the physician wasn't. I think for a lot of people, they've just resigned themselves to the fact that, for lack of a better word, healthcare can suck. Certainly the financial side of it, right? It's not going to be fun to deal with it, and it's probably going to be a real hassle.
Yeah, I mean, there's no way to skirt that. I mean, healthcare, a lot of healthcare experiences does suck, or they do suck. And I think that opens the door for individuals like yourself and what a lot of people are doing out there to enhance that. The second point you mentioned were quality metrics, and I want to make sure that I don't just gloss past that, but it's the third point that you mentioned from a patient experience, a consumer experience that really perked up my ears because just from a personal note, I decided at 34 years old that I'm going to do something I've been wanting to do since I was 16, and that is become a pilot, become a private pilot. So I enrolled in flight lessons, and I'm stoked, I'm pumped. But I had to go in and get a flight physical, and I walked into the most depressing office I have seen in a very long time because we do these, we help physicians in direct primary care, and their offices are always very energetic. Doctors are happy, the staff is happy, it's open, it's bright, there's personality there. And I walked into this and I'm like, my first instinct was, I got to get out of here. I'm either going to get more sick walking into this office, or I don't know what I'm doing here. Fluorescent lights, the drop ceiling, the old chairs, the carpet, a massive waiting room. And I'm like, good Lord, I forgot. Honestly, I did what a typical patient experience is like. And so that's when you said that third point. I'm like, oh man, that one hit home big time just recently here.
Yeah,
Um, so from your third point about the customer experience, recently I stepped into a primary care's office, primary care physician's office to get a flight physical because I decided to learn how to fly at the tender age of 34, something I wanted to do for my entire life. And I walk in, I step off the elevator, and immediately I was overcome by this feeling of gross. Ew, like why are people going here? Who wants to go to work in this office? Why does a doctor even thinking about returning to this office day in, day out? And that patient experience hit home big time because we're used to setting up direct primary care offices that you have the physician having personality in there, and they're fun, they're bright people, they're happy. And so when you mentioned that third point, that really drove that home just based on my personal experiences this past the past week or so. And I don't want to discount that. And I think a lot of people, and tell me your thoughts on this, but a lot of people discount, what am I going to feel and see and experience when I walk into a doctor's office? And then how do you guys codify that to show that, hey, the patient experience is going to be elevated by using our system and finding physicians that actually really care about their environmental aspect, care about their patients, and want them to have a good, comforting experience?
Yeah, well, absolutely right. I think as a patient, you want the facility that you go to, the doctor you see, you want to have as an enjoyable interaction with the medical system as you can. And a big part of that is that the staff are that they take time with you, that they're considerate, that the doctor takes plenty of time to answer all your questions and address any questions your family might have, obviously depending on the nature of what type of care that you're getting. And the way to make that information available is really just to close the loop. And what I mean when I say close the loop is that everyone that goes in and has something done, they then give an opportunity to give feedback to a company like Point Health that's non-biased, that they're not necessarily receiving a friendly email from the doctor's office saying, hey, thanks so much for coming in. We'd love it if you could take a minute and leave us a review on Google. But they're actually answering some questions for a third party where they can rate different aspects of their experience. And taking an approach like that, you get a lot more accurate information than you do when a doctor has sort of solicited feedback. And then the other thing that medical facilities do as well is they tend to only solicit feedback if they think they're going to get a positive review. They're not necessarily reaching out to patients where they know things maybe didn't go that well, asking them to leave reviews on sites like HealthGrade and Google. So there's certainly some, I don't want to say it's not manipulation of the data. It's not necessarily reviews that are currently available don't necessarily paint a complete picture.
Mm-hmm. And that's an important distinction to make. So I'm glad you did do that. In order for somebody to get a get the whole picture, there's going to be some good and bad. And so, if somebody's out there and it's like, well, this facility only has 5-star reviews, and you might want to be digging a little bit deeper. But Matt, give us a good overview, because I want to start diving into what Point Health is doing from more of that marketplace standpoint, combining or finding letting consumers find those good, worthwhile providers, and bringing the transparency to the whole thing. Because obviously, from a Freedom standpoint, we're big fans. Personally, I'm a big fan of anything that's price transparency in this industry. So give us that overview of what you guys are doing and how it's going.
Yeah, absolutely. So I think to understand where we're going now, you have to understand where we came from. So through a company that Point Health acquired, the Caris Group, we've got 25 years of experience helping patients figure out which facility that they should go to. And so we'd always done that in a very manual way. Someone would call into our call center, we would assign them a patient advocate that worked their case, would reach out to local facilities in their area, find out what the price was going to be, try to figure out everything they could to help the patient, and then we would sort of send the patient a report and say, hey, here's the facilities in your area that can do what you need to have done, and here's what it's going to cost you at each one. And what we wanted to do with Point Health was we wanted to take a much more tech forward approach to doing that, because it's really hard to scale some of those manual processes. And so it's really a big data play. We've been obviously got a ton of internal data around pricing. We've also got a ton of claims data, what our clients have paid. And then there's also a lot of data that's sort of available out there, whether it's from CMS or increasingly facilities are sharing their data, and certainly there's been some legislation that I think Biden is rolling back at the moment. There's hospitals have put out quite a bit of data, and so we're taking all of the data that we can and we're trying to organize it in such a way that we are able to mirror the shopping experience that consumers are used to when they go online to shop for other things. And so we want people to be able to search for a procedure and in real time get a list of facilities that are close to them that can perform that procedure, and then see what the cost is going to be. One caveat that I'll sort of give, though, is that anyone that says they're able to provide 100% accurate pricing 100% of the time and inside of healthcare is not telling the truth. I go back to this issue of data integrity. And so what we're able to tell patients is, at some facilities with a high degree of confidence, we think you're going to pay, $8,990. At another facility, we might say, we can't tell you exactly what you're going to pay, but based on historical data that we have, here's the average price for this facility for this procedure. And then if we move a step further away from the perfect thing, which is telling them the exact price, we might not even be confident enough in our own data to give them a number, but we might say with a fairly high degree of confidence, this is the facility that's going to charge you the least. And then here's sort of a stack ranking from least expensive to most expensive. So that's what we're trying to build. And it's really
learn, no. Healthcare Americana is a podcast for the 99% of people who get healthcare in America. We're not clinicians or policymakers. We're patients and caregivers, executives and advocates who are fed up with the status quo and have a desire to change it. We produce a weekly podcast that brings listeners backstage at innovative organizations across America that are putting patients first by delivering exceptional care to anyone and everyone.
And it's really it's been a 2-year effort for us to modernize something we've been doing manually for 25 years.
Now, I just want to make couple points of clarification there. What type of facilities do you usually work with? Because your comment on if somebody tells you they can nail their pricing 100% of the time, there might be some DPC doctors out there and people doing specialty care who say, "Hey, wait a minute, I'm charging this guy whatever's on my website, whatever's on my menu board." Are you working with facilities that are more in the insurance game? And I just wanted to clarify that point.
Sure. So we're working sort of, I would call it across the continuum from if a facility wants to reach out to us and give us their pricing information to the penny, we'll absolutely take it. All the way to the facilities that are, fighting any effort to put their prices out there.
Yeah.
With facilities like that, we are going to make as educated a guess as we can. And it's, at this point, it's not humans making a guess, it's algorithms. Here's what the data that we have been able to find tells us about your facility. But then we're obviously having to package that in a way that we disclose to patients. Here we're confident because our facility has told us this is exactly what they're going to charge you. Here we're not confident. Here we've done some data mining to put forward a guess. And then of course in the third case, it's like we're not confident enough in our guess to actually give them a number. We'll just tell them where we think it is. Sort of, this is a high price provider, this is a low price provider.
Oh gosh, I bet that is an interesting conversation when that happens, when someone just throws their hands up and says, I can't even start to quote you without.
Well, and it goes back to this issue of bundled pricing. If every facility offered bundled pricing, our lives would be a lot easier. And while we have the exact cost at, I would say, most places for any given CPT code, I don't want to get too into the weeds of healthcare billing. What we're not confident in is what other stuff has been bundled with it, and whether or not, certainly on the hospital end, whether or not they're including things like anesthesia or they're going to bill separately. And so, but we get better at it every day. And of course, the more patients we help, the more accurate our data becomes. Mm-hmm. And I think so we've got, that working on our favor. And then we've also got working in our favor the fact that more and more facilities are willing to share their prices. And I think the fact that the price transparency movement, it's really impossible to stop, right? Because if a person is able to see the cost, they're more likely to go to that facility. And ultimately, the facilities that aren't showing their costs are going to have to start doing it because they're losing too much business. And I mean, we can go in if you think it would be interesting into some of the underlying economics of why I believe that'll happen, but I'm not sure if you want me to go down that rabbit trail.
Well, I was about to ask you, because one thing that seems to come to mind every time when I'm hearing you make these points. Have you been surprised? Have you had any pushback where people are just downright hostile to what you're trying to get out of them?
You cut out there at the last second.
Oh, sorry. I was saying, have you been surprised? Let me go back and Taylor's going to have a field day with this episode. One thing keeps popping into my mind as I hear you make these points is, what type of surprises and have you encountered in these conversations? I mean, have there been anybody who's been downright hostile to what you're trying to do when you call them up and say, hey, I'm building this database, I'm building this marketplace, it's a data-centered approach to it, we want to show a lot of transparency. Do you guys want to participate? And if yes, what are your prices for all these lists of items? Has anybody just been like, oh, screw you, it's not going to work?
They haven't been what I would call hostile, but they have been pretty direct. And one of the things that really was a highly enlightening conversation for me is I was sitting in the office of one in the C-suite. I'll just leave it at that. I don't want to say any names, for a company called Ascension. And Ascension has, it's a fairly large hospital chain in this part of the country. And basically what they said, Matt, you've got to stop coming to us, asking us to give better prices, more accurate pricing information around self-pay patients. And they said the reason for that is they said, look, most of our facilities, the level 1 trauma facilities, we've got all of these other costs that other facilities don't have to incur. We've got to keep a a helicopter on the helipad with pilots ready to go. We've got all of these things that the ambulatory surgical centers don't have to do. We don't want to put our pricing information out there because it makes us look like we're more expensive, and we are. We're not the place that you come to save money. But I think, that conversation, it was really telling for me, because that attitude, I think, is pretty pervasive among the hospitals. Is they're not necessarily, at this point, they haven't looked to compete on price because they haven't had to. But as the ambulatory surgical centers, as more and more ASCs put pricing information out there, and they start to siphon the business away from hospitals, the hospitals are going to have to put pricing information out there and attempt to compete. So you've got that happening. At the same time that is happening, you've also got the C-suite in corporate America that's responsible for paying health insurance premiums really starting to pay attention to the cost. For most businesses, employee benefits are either the second or third largest item on their P&L. And, just like there's no way a CFO would allow an employee to constantly stay at a hotel that was $10,000 a night when they were away on a business trip. Right. They're becoming more engaged in the healthcare process, and they're looking to work with plans that actively push people to better value providers, rather than making the recommendation of, hey, go to the big hospital that you're closest to.
Right. Yeah, that's fascinating, that conversation you had in the Ascension C-suite offices, because that is a recurring theme that I hear a lot, is that, detractors of what we're trying to do from a transparent, low price, or actually a fair priced medical care, is they say, well, what about emergencies? You can't plan for emergencies. There's no way that you can put emergencies up on a website or anything like that. But that is like the last nugget, the last frontier that they always cling to. And, you had a great example there with the helicopter. And yes, emergencies do happen, but that's where insurance is actually valuable for people. Now the pandemic has exposed that a lot of hospitals, I think I saw anywhere from like 30 to 60% of their revenue comes from elective surgeries. That is not emergent care. And like you said, as ambulatory facilities siphon that off, what are those emergency centers going to be left with?
Well, I mean, I think, yeah, that's an interesting question. I think, another thing to highlight is, just want to reiterate what you just said, which is that it's a false argument. And there's two that they typically put forward. It's the emergency argument, and it's the one about complications. And, the analogy that I like to use is, if I, open Uber or Lyft on my phone, and I say I want to take a trip from, my house to the office, it's going to tell me, we think it's going to be $12. And of course, if we hit an accident on the way, or we have to reroute because of construction, they'll adjust it up appropriately. And if we get every green light on the way, they'll adjust it down appropriately. But most of the time, it's actually really, really close to what they said it would be. And it's actually the same thing with medical care when it comes to non-emergency procedures. It's just this notion that there's complications, way too complicated and impossible to put prices out there. It's just not true. They only actually happen about 15% of the time. So 85% of the time, they could put out a really accurate price if they wanted. And I think everybody would understand complications happen. This is the price if things go according to plan. If we open up your knee to replace this, this one tendon, and it turns out that there's something else going on that we fix at the same time, people will be reasonable and anticipate that, yes, if that happens, go ahead and do it. It's going to cost me a little more. But so many of the arguments that the hospitals put out there, when you really start to dig in, the reality is they don't want to display their prices because they want to continue to be able to charge outrageous amounts. It doesn't matter what your argument is. $68,000 is too much to pay for a rotator cuff repair. $70,000 is too much to charge to repair, a disc in somebody's back. Hospital prices are outrageous. And some hospitals are worse than others. One of the things I did a couple of years ago was we ran some reports to take a look at a lot of the data that was coming into CMS and take a look at the average percentage of Medicare that facilities were billing. And we found multiple facilities. I think it was 10% of facilities on the hospital side were charging above 800% of the Medicare price. And so when you consider that the Medicare price directionally is about a hospital's break even, there's no other industry where you could say our cost to provide this is $1,000, but we're going to charge $8,000, because competition would come in and drive that price down. But
Right.
because the pricing is so hard to get to in the healthcare world, it's actually been happening for 50, 60, 70 years.
Right. The only winner of monopoly is the monopolist. Everybody else gets to lose, right?
That is correct.
So in your argument, it's like, if I'm a hospital, or if I'm able to charge $7,000 margin, I'm going to say, hey, great, this is awesome. But like you said, with that data being out and about, people are going to look at that and say, oh, wow, that's pretty lucrative. I'm going to jump in there and start lowering costs. Competition's good. Not necessarily the greed aspect of it, but the competition is good. It can be healthy for markets all over the place. So Matt, I want to ask you here, focusing again on Point Health, where are you guys seeing your greatest amount of growth? I mean, is it bringing on facilities who want to participate, or on the flip side, is it consumers and groups looking for a one-stop shop in order to have all the data in front of them to make an educated decision?
Yeah, so I would say right now, we're in this sort of, we're still in the building our product stage, and so we haven't actually gone to market yet with our tech forward solution. I think we're going to have our MVP out in the next, call it 60 to 90 days. So we've really focused on gathering the data, and most of it has been a big data play. It's been looking at multiple data sources, whether it's claims data that we've been able to acquire from clearinghouses, whether it's CMS data, data that's just available out there in the public domain. We've spent a ton of time really trying to figure out what information is out there, what does it actually mean, how do you slice it up and present it in a way that an average consumer is able to use it. And so we've been focused on internal stuff, and at this point we're now getting ready to go to market. And from initial conversations we've had with potential clients, there's certainly an appetite for a tool like this, whether you're talking about for insurance companies, healthcare sharing organizations, discount medical plans, all the way along their supply chain of healthcare. People are eager for a tool like this that allows their members to make informed decisions about where they go.
Right. I'm going to give you the last question here, the final say as we wrap this our discussion up here. In your opinion, what needs to happen in order for us to build what I'm going to describe as, air quotes, the perfect healthcare industry? Knowing, what we know and based on all your experiences before, what needs to happen?
Yeah, so it's a really great question. And, I tend to actually believe that there's good things being proposed on both sides of the aisle. You cannot have a good healthcare system that doesn't have a safety net for the neediest people. You need to have, some segment of the population whose healthcare expenses are covered collectively by society. But you can't take that to an extreme and say, hey, let's move to a one-payer system, because then you lose out on all of the innovation and all of the things that happen in free markets. I don't want the government to run our healthcare any more than I want the government to be in charge of Gmail. But I want the same economic factors that allowed for the creation of Gmail to happen inside of the healthcare world, so that, look at all of the innovation that's come out of technology compared to something like the US Postal Service. So I think in a perfect world, you have a completely free market healthcare system where you have price integrity, where you have the same price charged no matter who is paying for it. Doesn't matter whether the government's paying for it, doesn't matter whether insurance is paying for it, doesn't matter as a consumer whether you're paying for it out of your own pocket. Ultimately, that is the fairest system. Now, if some segment of the population has their health care covered through tax dollars in a program like Medicaid, I think that's a necessary part of the system, but they should be paying the same thing as everybody else. Because the minute you start charging different things to different people, you end up with the convoluted maze of healthcare that we have now, where no one can understand it. And there's all of these sort of under the table deals cut between insurance companies and hospital systems, and it leads to a really it's a fundamentally immoral system when a self-pay patient can pay 800%, 8 times what the government will pay for the same thing. And so I think you have to take the best of the free market, but you need the safety net for the most vulnerable parts of the population.
Matthew Dale, Chief Executive Officer, Point Health. Thanks for joining us here on Healthcare Americana.
Hey, thanks so much. I really appreciate you having me on.
That's going to be it for this episode. Once again, I am your host, Christopher Habig. For all of our past episodes, visit healthcareamericana.com for any more information on direct care and free market medicine. Visit freedomhealthworks.com. Big shout out to Taylor Scott for production of this podcast and Melissa Turpin for managing. That's going to be it for this episode. Thanks for listening. Hi again, everyone. This is Chris. At Healthcare Americana, we're always on the lookout for great stories to tell in the healthcare industry. We'd like to hear yours. Check out healthcareamericana.com and send us your ideas for episodes or if you'd like to be a guest. Thanks again for listening. Hope you enjoy it.